The study to be introduced today is a study that analyzed the effects and side effects of anticancer drugs and the relationship between survival and biomarkers in the cohort of the RAINBOW study from the perspective of liver metastasis. In advanced and metastatic gastric cancer or gastroesophageal junction cancer, liver metas appear in about 40%. The 6-month survival rate is as low as 20 to 50%. It has been reported that the risk of liver metastasis of gastric cancer increases in the case of intestinal-type carcinoma, and age, tumor site, and pathology grade have also been reported as risk factors. In addition, several studies have reported VEGF as an important risk factor for liver metastasis. Ramucirumab is a VEGFR2 antagonist. And the RAINBOW study showed that combination therapy with paclitaxel increased overall survival in metastatic GE junction cancer. Let's take a quick look at the design of this RAINBOW study. The RAINBOW study was conducted on patients with locally advanced gastric or GE junction adenocarcinoma, and included all patients with ECOG 0 or 1, measurable or non-measurable evaluable disease. Enrolled patients were randomized into the ramucirumab and paclitaxel group and the placebo and paclitaxel group, and this is a phase 3 clinical study comparing the overall survival of the two groups. In this study, the data of the RAINBOW trial were classified according to the presence or absence of liver metastasis, efficacy and safety were compared, and the relationship between VEGF biomarker and overall survival and progression-free survival was investigated. Baseline demographics. Looking more closely, the proportion of males in the liver metastasis group was high, and the measurable rate was also high. Also, the intestinal type was more common in the liver metastasis group, and the ratio of 3 or more metastatic sites was also high. Regardless of the use of ramucirumab, with a hazard ratio of 1.13 and a p-value of 0.157. Liver metastasis did not appear to be a significant prognostic factor for overall survival. However, in progression-free survival, a hazard ratio of 1.36 and a p-value of 0.0003 were found to be significant prognostic factors. Kaplan-Meier curves for overall survival and progression-free survival between subgroups. First, it is a curve for overall survival. Regardless of liver metastasis, the ramucirumab group had a longer median overall survival, which was 9.6 months, than the placebo group. However, looking at the hazard ratio, it can be seen that the ramucirumab group has more treatment benefit in the liver metastasis group. The following is the curve for progression-free survival. Median progression-free survival was prolonged in the ramucirumab group regardless of liver metastasis. Again, looking at the hazard ratio, it can be seen that the ramucirumab group has more treatment benefit when there is liver metastasis. The overall response rate, which represents the ratio of CR to PR, was higher in the RAM group with liver metastasis. However, there was little difference in disease control rates between the two groups. Here is the table for adverse events. The rate of proteinuria was high in the group without liver metastasis. However, the rates of liver injury or liver failure were similar regardless of liver metastasis. The relationship between VEGF-related biomarkers and overall survival and progression-free survival was analyzed, but no significant results were found. Since the data used in this study was not focused on the liver metastasis subgroup, the biomarker date was limited, and the authors mentioned that the results do not seem to be well selected. Conclusion: liver metastasis is a negative prognostic factor for progression-free survival. However, when there is liver metastasis, ramucirumab and paclitaxel treatment has a positive effect on improving progression-free survival. In addition, ramucirumab and paclitaxel combination therapy may be a treatment option for patients with metastatic gastroesophageal junction adenocarcinoma, regardless of liver metastasis.